Hello, everyone. My name is Dr. Brooks from the Scottish Rite for Children, and I'm one of the specialists in scoliosis as well as back pain. We have a patient here today that is going to help us with our physical examination. So a lot of times when it comes to back pain and scoliosis, they can go hand in hand. For you all, you may be seeing children who have back pain only, or children who you think might have scoliosis, or they may be intertwined. And so the goal of this video is to really help you to parse out different physical exam items that will allow you to hone in on what the cause of the back pain is, or whether the patient actually has scoliosis. So the most important thing first is that whenever you're examining a child's back who's complaining of back pain or who you think might have scoliosis, you want to make sure that their shirt is off. If they're male, that their shirt's completely off. If they're female, that they have a sports bra. Or if they don't have a sports bra on, then at least they're wearing a regular bra with a gown so that you can really examine the entire back. I usually have my patients stand up first. We'll have you stand up and then face the wall. And first, you want to make sure that you do a visual examination of the patient's back to make sure that there are no clear abnormalities in the skin or anything else. First, I'm checking for shoulder symmetry to make sure that one shoulder is not elevated in relation to the other shoulder. Next, I look at the inferior border of the scapula to make sure that there's no asymmetry there. And then I also look at overall the paraspinal muscles to make sure that they also look nice and symmetric. I want to make sure that there are no old incisions or scars, particularly down here in the lumbar spine, that might indicate the patient might have had a previous detethering procedure of their spinal cord that maybe the family is not aware of. So today, this patient's back actually looks normal, which is great. And so the next step I do is palpation. I want to make sure that I touch the different areas of the back and ask them if it hurts anywhere. So I usually start at the top, and I usually start in the midline, feeling along the spinous processes. Does that hurt?
No.
Okay. And then if there's no pain in the midline, then I move to the paraspinal muscles, pushing on the paraspinal muscles as I go from top down to the bottom, knowing that most back pain is going to be in the lower spine anyway. Do you have any pain in your lower back?
No.
Okay. And then also sometimes if the patient is complaining of a lot of lower back pain, some back pain can be from pain in the SI joint. And so I'll actually push right on the SI joint here on each side. Any pain there?
No.
Okay, perfect. Now, since they don't have any pain there, I'm going to have the patient step back. And then I want you to reach forward and try to touch your toes without bending your knees. But it's important to keep your knees straight. All right, go for it. Knee straight, knee straight. Perfect. So you can hold it right there. So with this forward bend test, first what I'm looking for is whether the patient can actually touch their toes. As you can see in this example, this patient actually has some tight hamstrings and is not able to touch their toes. But also in this position, I'm looking for any asymmetry of the paraspinal muscles, particularly if the child does have scoliosis. I'm looking for any rib humps. If the scoliosis is focused in the thoracic spine, you would most likely see a rib hump on the convexity of the curve. If the patient has a curve in the lumbar spine, you might see a hump in the paraspinal muscles on the convexity also. And so because this patient does not have any scoliosis, I don't see any asymmetry, and that's great. Did you have any pain when you reach forward and try to touch your toes?
No.
Okay. Next, and this is very important when it comes to back pain, you also want to check whether the patient has any pain when they extend their back. So what I do is I put a hand on their waist, and then I put one hand on the middle of their back, and then I lift it off. And I say, keep your waist straight, but lean back towards my hand. All right, go for it. So in this case, sometimes they may want to lean their whole body. I don't want you to lean your whole body. I just want you to bend at the waist, okay? So putting my hand on the middle of your back, and then, yeah, just like that. Perfect. And now you can stand up. Did you have any pain when you did that?
Yes.
Perfect. And I told him to say that so that I can make an example that if a patient has minimal to no pain on forward flexion of their back, but increased pain on extension of their back, particularly in their lower back, that's a pretty, that is a sign that the patient could potentially have back pain secondary to a pars defect or what we call spondylolysis. And so that's a very specific finding that I think is very easy for any clinician to check, is you have the patient touch their toes, you have the patient extend their back, and if they have more pain on back extension, particularly in their lower back, you got to look for a pars defect. So the next part of the exam, I do want to check their reflexes. Again, you don't need to be a neurologist in order to do this exam. Essentially, the two reflexes I really check for any patient who might have back pain or anything related to scoliosis is in their knees and their ankles. And so I feel for their patellar tendon, then I feel for the tibial tubercle right below that. And then this is my makeshift reflex hammer. I give it a little tap, give it a little tap, give it a little tap, give it a little tap. If there are no reflexes, that's not really a problem for me. The thing I get concerned about the most is hyperreflexia. So if I tapped and their foot really just jumped off the table, that is concerning that there may be some abnormality in their neural axis, either a syrinx or a Chiari malformation that needs some further workup. But hyporeflexia, or just really no reflexes, is totally fine in our book. So that's at the knee. And then when it comes to the Achilles reflex, you take your one hand and you dorsiflex the ankle and you tap right on the Achilles tendon. And the reflex is when you tap, the ankle should plantarflex slightly. Again, hyperreflexia is something that we are concerned about, not really normal reflexia or hyporeflexia. Then from there, you can use your same tool, start from the heel and scratch from the heel up to the toes. This is called the Babinski. And as you know, normal is downgoing or unresponsive. Upgoing toes would be abnormal. Again, something that we would be concerned about and potentially do a further workup. In this case, his toes were downgoing, so no abnormalities there at all. And then while they're still sitting, I do want to check for clonus. And so you take their foot and you quickly dorsiflex it like that. Take their foot, quickly dorsiflex. And of course, clonus would look like the foot flapping one or two or sometimes more than that times. When I say flapping, I mean plantarflexing quickly after you do that very quick dorsiflexion. Again, if you see that, that could also indicate an abnormality in the neural axis. Although we have seen some patients who are on different medications, that could actually cause clonus. Particularly some kids are on medications for ADHD and other things. We have seen that result in clonus even if there's no other abnormalities. Then of course, while they're sitting, you do want to check for sensation to make sure that their sensation is symmetric. So I pretty much start at the foot and I feel on the sides and say, does it feel the same or different?
The same.
Same or different?
The same.
Same or different?
The same.
All right, perfect. And I don't check really any reflexes in the arms because the majority of problems that come from pediatric scoliosis or back pain happen in the thoracic spine. And so things happening in the cervical spine that controls the arms is really a little bit less important in the general workup for pediatric back pain, unless the child, of course, is coming in specifically complaining of neck pain. And so one other thing we had them do, I'm going to have you lie flat on your back, put your head here and your feet down there. If the patient comes in complaining of back pain, we also want to make sure that there are no shooting pains that are causing this back pain. And so I have the patient do a straight leg raise. So kind of lock your knee and lift your leg up straight in the air, just one leg. Is there any pain that shoots from your back down to your foot when you do that?
No.
Okay. Now let's try with this other side. Any pain that shoots from your back down to your foot when you do that?
No.
Excellent. You can put that down. So if the patient reported that they did have pain, may indicate that the patient has back pain secondary to some type of disc herniation that might be pushing on one of the nerve roots and causing shooting pains. And so the straight leg raise is a very nice test in order to evaluate that. One other physical exam finding that you can do, particularly if the back pain might be somewhat hard to figure out, is something called the Faber test. And so the Faber test pretty much stands for flexion, abduction, and external rotation. That's how you get Faber. And then you take the straight leg, flex the hip, externally rotate, and then leave that foot on the opposite knee. And then you slowly push down on the knee. And if that patient experiences pain in their SI joint, that could indicate back pain secondary to inflammation of the SI joint, which you sometimes see in patients with rheumatologic abnormalities or just primary SI joint problems. And so that's the Faber test with his left leg. We'll do it with his right leg. There we go. He's not very flexible, so he's making it hard on me. We're pushing that down also. Any pain in your back when I do that? No. Okay. When it comes to the neurologic exam, either for scoliosis or for back pain, we don't necessarily need to do as detailed of an examination as a neurologist would do. We just want to make sure that all the neural pathways are working. So the way we do that is pretty straightforward. We have the patient do various movements which tell us that everything is working. So the first thing I have my patients do is walk on their tiptoes in a straight line. So walk on your tiptoes towards the camera, please. All the way up. All the way up. There we go. Perfect. Now I want you to walk to that wall on your heels like this. Excellent. Now I want you to act like you're walking on a rope and you're trying not to fall off. So I want you to walk in a straight line so that your feet touch each other. And make sure you walk in a straight line. You can walk towards the camera. It's actually a test to see whether their cerebellar function is normal, which in some conditions, particularly Friedreich's ataxia or other conditions, they may not be able to walk or be coordinated enough to walk in a straight line like that. Perfect. Why don't you stand right here and face the camera? And next, I'm going to have you hop up and down on one leg. Hop up and down on the other leg. Perfect. Okay. So that concludes the physical exam, which again highlights some things you might want to do if you're looking at a child that has back pain or scoliosis or both. And so I want to thank my patient for being here today. And hopefully this was helpful as you all see your own little ones in your own practices.